So my name is Isaac Kobe. I am a middle-grade vascular trainee. I'm a clinical fellow at the Royal Infirmary of Edinburgh, and also starting a vascular training program in the East Midlands next year. I graduated from medical school in Kenya, and after that got into training in general surgery before deciding that vascular surgery is what I wanted to delve in. So I moved to England about 3 years ago, got into vascular as an international vascular training fellow, and this reinforced my interest and passion in vascular surgery. Initially, I wasn't sure that I wanted to do vascular surgery, but as I delved deep into vascular surgery, I realized that it's a very dynamic field. It's one of the few fields in surgery which involves operating on all parts of the body from the neck down. It requires great anatomic detail, good hand skills, and therefore all this made me develop passion and interest. And the more that I do vascular surgery, the more I'm sure that I made the right choice. I have a few interests outside work. First and foremost, since moving to Scotland, I have gotten into hiking and actually recently just formed a club of hikers with a long list of moonrows and hills and mountains to hike. I'm also into sports activities, mostly racket activities. I've played lawn tennis since I was a child, and all varieties of racket sports, including squash, badminton, and table tennis. I also like swimming. I'm also a global surgery scientist, so that means that I am in a community of global surgery practitioners who hold conferences each year trying to raise funds and advocating for safe and equitable surgery in all parts of the world. My favorite operation, I would say I have a couple of operations that I really enjoy, but the one that I would say tickles my fancy is a carotid endarterectomy. This is because it is an operation that encompasses significant anatomic detail. So in a carotid endarterectomy, you'll see all the nerves, you'll see all the blood vessels and fine muscles of the neck. It's an operation that requires good hand skills, it requires good hand-eye coordination, and also an operation which is unique because it is a preventative operation, as most operations are curative operations. Finally, it's an operation whose results are usually immediate. So within the next 24 hours, you will know if the operation has gone well or if something has gone wrong. And so you're able to take corrective steps. I would say the reward in vascular surgery, it's in its character. So vascular surgery is a very dynamic field, so that means that it is very interesting. It's a field that requires you to take care of conditions that involve basically most of the body parts and cavities. So that means that you have a wide variety of operations, from major surgery to sort of small and minor procedures. So this means that you'd always really be interested, and then you'll have a lot of intriguing cases. I would say that at times vascular surgery can be quite intense, can be quite dynamic, so you have to be really switched on. I think also the modes of treating our patients are changing with time based on research and based on outcomes, and anyone who gets involved in vascular surgery has to keep up with that and adjust their practice. And lastly, though vascular surgery offers significant interest in terms of anatomic detail, most of our patients have significant comorbidity. So that means that you have to be quite good at recognizing other medical problems that the patients have and being able to refer them to appropriate specialties to help you with it. There would be two types of a work week. So it would either be an on-call week or it would be an elective week. So an on-call week would be one that would occur every 6 weeks, and that is a very dynamic and unpredictable day or week, I would say. So where you come into the hospital and you manage anything that comes through the door, that would be either referrals from general practitioners, from other specialties, or patients coming in through the A&E, and that would be a day where the hours would range from the 8 a.m. in the morning to about 8 p.m., so about 12 hours, and this is a 4-day working week. The elective week, which is every other week, then would probably comprise 2 to 3 days of theatre operating days, 1 to 2 clinic days, and maybe an admin stroke research stroke MDT day. And again, that would be maybe like a 10-hour day from 8 to about 5-6 p.m. And on the operating day, then that would be operating on a wide variety of conditions. So that we either major operations, minor to intermediate operations, or seeing patients in the clinic with several vascular conditions. So quite dynamic, quite interesting, a mix of things. I think it is possible to have a good work-life balance. I think you have to be deliberate about work-life balance. So that means you have to actively seek interests outside medicine. And most people do have interests outside medicine, other social activities. And I think also you need to be organized. That's one, you need to be organized. And then two, I think you need to be, you have to be very clear with your limits. And I think if you organize your day well, if you're organized, and if you try and get your work done during the day, you should have ample time outside your work hours to engage in other activities. So I think the key word here is just being quite deliberate in organizing your time and in seeking other activities outside work. It is not. I think it's false to say that you cannot have a good work-life balance in surgery or in vascular surgery specifically. So I would say that they should get some experience, because it would be good for them to be sure that they want to get into surgery. It's a very exciting field. It is not necessarily for everyone. So there are some people who would enjoy surgery and some would not. So they should get experience in surgery, and once they're sure, then they should be deliberate about what they want to do, and they should do their best to try and be involved in activities that would improve their portfolio, to improve their chances of getting a good job in surgery.